The Healing Net Foundation features the faces and voices of a community touched by a rare disease, neuroendocrine cancer. Patients, caregivers, healthcare providers, and supporters tell us their challenges, lessons learned, and inspirations.
I woke up one morning in pain, and I told my husband that I needed an ER. And after a CT, I found out that I had a mass in my abdomen. I was told that there was a neuroendocrine tumor inside the mass. I didn't know anything about neuroendocrine cancer. I didn't know anything about neuroendocrine tumors or carcinoma, and I started to research online. I could find very few articles, very few websites, and then I was finding that some of the websites were giving contradictory information. So it was very frustrating. I had neuroendocrine, and I'm only sitting here because an oncologist from breast cancer 15 years ago admitted me to the hospital, and therefore I had to have surgery. But if I had waited the 3 weeks that the surgeon's office wanted me to wait, I wouldn't be sitting here.
I think the biggest challenge that I see out here in terms of achieving the best possible care is one of knowledge of this cancer, both from the patient perspective and from the perspective of physicians who are diagnosing as well as trying to treat this particular type of cancer. Knowledge and experience with this cancer by physicians is lacking.
So when a patient comes with high symptom burden, I feel that community oncologists are not well aware of drugs that could help much the patient, specifically from the diarrhea perspective, from the flushing. New developments have been out, and FDA-approved medications have been out, and I think community doctors are not aware of what is the cause of a diarrhea that is very complicated.
We don't understand the molecular underpinnings of neuroendocrine tumors the same way we do for many other cancers. And that's a clear deficiency.
It's such a heterogeneous disease that not everybody fits the same bag. So you have to really individualize the care of your patient. And sometimes the clinical trials, the data that is available, are not do not necessarily fit the patient that you have in front of you. And that's when experience is really important. So also brings the point that these patients should be given the opportunity to be seen by a neuroendocrine tumor expert, because they see several patients and that can help with the experience. Unfortunately, one of the challenges is that not every single city or every single state has a NET expert.
You must know that these diseases are really hard to diagnose in early stages, and we have no screening markers to use. So a good training is very important to diagnose these diseases at an early stage.
I believe the biggest challenge for patients these days is they don't know what neuroendocrine cancer is, so they cannot be their own best advocate if they don't know what it is, and B, their doctors don't know what neuroendocrine cancer is. And so how can they possibly be treated right and diagnosed properly?
If you have been newly diagnosed and it's a cancer that you can barely pronounce, and then an oncologist who is supposed to be the cancer doctor doesn't have the knowledge that he or she needs to be able to help you, it's a terrible place for a patient to be.
I had the pleasure of training in neuroendocrine in Europe, and so I saw a slightly different way that it was practiced. When I came back to America to take care of my patients, I saw that there was a real lack of knowledge about the disease, not only among the patients, obviously, but even among the physicians and caregivers.
I'm in a unique position because I sit on both sides of the fence of being a patient and also a healthcare professional, and I think that on the healthcare professional side of things, it's a difficult disease process to understand because it's not as prevalent as, well, maybe more prevalent than we think it is, but we don't see it a lot in day-to-day practice unless you're in a specialty center.
The neuroendocrine tumor patients who do the best are those who better understand their own situation, know what their options are, and at least have that in their hip pocket when they go in and talk to a physician, particularly for the first time.
Well, the biggest challenge as I did my research was really finding a local expert to depend upon to have follow-up. And I found that many of the institutions did not have a NET expert, and that the information available at the institution was very limited and often wrong, unfortunately. And we were pretty well connected in the medical community, as my husband is a physician, so it was very frustrating, honestly, to find that expert so that I could be treated locally and then consult from afar with a NET expert.
These patients may be driving for hours upon 4 to 6 hours to visit with their neuroendocrine physician, and in these rural areas, are they able to get the care that they need? Are they able to get the care that they know of? Are these physicians, do they have the resources to understand where their NET specialists are?
Neuroendocrine is a relatively unusual, somewhat rare disease. A lot of people don't learn much about it, and so a physician may only see one case in their whole career. So I always encourage people to really be the captain of their own ship. Get your own knowledge, learn about things, and then see if you can find an expert who can help you. And then and only then, once you've assembled a team and you can get your care in the right time by the right people.
I try to inspire everybody, gosh, you're fighting for your life here. What could be more critical? Get the proper treatment, get the best treatment you can have, and research and find the best doctor for you.
I think it's really important to identify a multidisciplinary team that can look after your personal care. MEN1 is an example, is a very common abnormality that has a big impact on how patients respond to treatment. In addition, the primary site makes a big difference. The degree of disease makes a big difference. The actual tumor behavior makes a big difference. So no two patients are ever the same, and I therefore feel it's really important to be seen by a multidisciplinary team that can do a complete workup and actually try and give you the best potential outcomes.
No one individual can know everything there is to know about all the various aspects of a neuroendocrine tumor patient's problems. And so if you have a group which is working together, it's much more efficient for the patient, and it makes them feel much more comfortable knowing that if one individual doesn't have all the answers to their questions, they can get those answers fairly quickly.
I know that even getting more than one second opinion, a third, fourth from different disciplines, it's affected how I treat patients, hearing another opinion from someone else, and it's humbling, but it's really important.
If you only have a hammer, everything looks like a nail, but if you're in a group of people, many people with different areas of expertise, at a good center, you can combine. So finding that right place to get your care, I think, is a major challenge for most individual patients.
All the training is, focused on breast cancer, colon cancer, melanoma. So all the medical oncologists, they are who they are because who they train them and the environment, where they were trained. It's really not their fault if they only see 3 neuroendocrine patients in their fellowship. How you expect them to know enough?
And there's a handful of just fantastic, great specialists that we all need to find, and it's difficult for people to find them. There just isn't enough of them.
Certain things still, it's hard to adjust your expectations. I get to look at something and say, oh, I used to be able to do that. Sometimes you kind of, you look at the negative side of that and say, well, you've lost. And so I try not to do that. I just kind of look at me as being a new me. And, I've also gained a lot. I mean, it's in terms of my relationships, we've had more time together. I've had more time with my friends. I've been very intentional about investing in my friendships, and I think, before 2015, I didn't do that as much. I was more, just working a lot. I don't work as much anymore.
As a partner in the journey, there is a separate sense of loss and grieving, a loss of identity, a loss of what I was, who I was. I did give up things or walk away from who I was before as a nurse practitioner, and someone who was had a lot of skill in that field and took on a whole new role. So a lot of the challenges have to do with, number one, balance, trying to find a balance in all of it, while wearing multiple hats. So I do a lot of different roles, and of course there is the caregiving. There's navigation, there's insurance warrior. I deal with all the denials. I communicate with all the medical providers and facilities, scheduling, dealing with pharmacies. And the researcher, I deal with a lot of the research and keeping up to date with everything. And then there's life, there's our house, I became a chef. There's a lot of roles, and knowing when to switch the hats.
One thing that's really become clear is how things look to me now in terms of decision making and putting values where I may not have before, in order to just make day-to-day decisions, also big decisions in my life, and how that prioritization of those things has become so much more transparent since this diagnosis, in a good way.
the physicians don't necessarily know exactly what the patients are feeling and what the challenges are for our patients. And I think we should focus a lot more on quality of life issues and talking about how to approach neuroendocrine tumors in the long term.
I've learned to be humble and to be open to opinions of the entire treatment team, but most importantly to what patients tell me about how they perceive their disease and what's meaningful to them. That's been my biggest lesson.
Well, I've learned and I've witnessed that if you find the proper care and if you get a specialist or a doctor that understands your disease, you will do better, live longer, and have a much better outcome.
So it's really important to build that level of trust. And if you get to a point where you're just up against a brick wall, you feel like you're beating your head against the door and you're not getting anywhere with your physician, I think that's when you have to be willing to seek a new doctor.
I think that you have to put out some knowledge and understand and hear where they're coming from and what position they're taking. Are they acceptable of the information you're portraying to them? Are they interested? Are they looking to look into it further with you and take the journey with you? Or do they want to just shut it down and lead it to someone else? It's difficult.
Patients need to communicate with other patients about their experience. Not that their experience is necessarily going to apply to another patient's situation, but at least it gives them some idea of opportunities out there that they may not have ever been aware of, or resources that they're now becoming aware of that they could turn to answer the questions that they're going to have about what are my next steps.
Every patient has a story, every family has a story. My mother had a story. Cancer care is very complicated from the family perspective and from the doctor perspective and from the patient, from the community perspective. This is needed to reach out to patients on how we can help.
I see the incredible courage and the incredible fight that these patients have.
I think as much as anything, I'm inspired by the patients I see and treat. These people are, you might even term them professional survivors.
Definitely one thing that was very inspiring from the very beginning was our community. From the moment that I was hospitalized, I had a strong sense of there being a lot of people, a lot of friends, a lot of family who were surrounding us with their love and prayers.
We felt like we had a small army, or a big army around us, and they carried us when we could barely hold it together. When we had difficulty hoping, they said, "We will hope for you." When we were down, they said, "We will carry you, we will pick you up, and we'll get you through this line."
I'm inspired every day by the strength and courage I see from my patients. I don't ever want to know what it's like to get a diagnosis of cancer. But It happens all the time. And when it does happen, it's a shock, and in a moment, your life is completely changed.
I've always had a family that has supported me and loved me and never made me feel like there was anything that I couldn't do. From the time that I was a child until, as an adult, and in my husband, my children, my family gives me a lot of inspiration and hope.
I've been inspired by the fact that there's great collegiality, great support amongst experts, that people are talking and doing things. There's been tremendous progress made in terms of therapies. There is potential for the future that's enormous. There's great collaboration. This is a family, I think, that is really coming together very nicely to forward the field, and I see great progress and great future ahead. There was a time when we just had nothing else to do but watch. Watching at times is appropriate, but now we have multiple different ways of treating patients, and I think collectively we're learning a lot more. There's been real progress made in basic science, and I am sure that that will translate in due course into improved therapies and clearly better outcomes.
I think my biggest inspiration are the patients and their stories. I always love to hear about their life experiences and see what moves them. So that's number one. And also another inspiration that I have is my senior colleagues. They have been doing this for so long. I look at their trajectory and how much they change the field, they move the field forward, and really gives me that between my patients and my mentors and senior colleagues, the inspiration to keep moving forward with treating this disease.
I draw inspiration from lots of things, primarily my faith in God, knowing that He's in control of my life, and things do happen for a reason. I gain a lot of inspiration, frankly, from talking to other patients and being connected with people that are going through similar circumstances and understanding symptoms, and that the disease process affects us all individually, but also together we have a lot of similar things that are happening in our lives, and it's good to be able to communicate with others that are going through the same situation.
I've been inspired by the people that I've met along this journey, and I call it a journey because that's just what life is. Life is a journey. So, navigating cancer, a cancer diagnosis is just part of life, if that's kind of the card that you've been dealt. So it is a journey, and who do I think I am to be running a national foundation and trying to educate doctors and nurses and medical providers? What is that? But the people that I have met and the expertise that I have gleaned from them has motivated me.
The thing that inspires me the most in fighting for awareness for neuroendocrine cancer is my daughter. After watching her die from neuroendocrine cancer so quickly, I know she would want me out there fighting as hard as I can to bring awareness to this and help other people.
What inspires me is the work that I see Healing Net doing. They're trying to get all the information, and they're trying to get people together to talk about this. They're just doing so much that it's a great inspiration. People just never hear about neuroendocrine, and that needs to change. The news media needs to change the way that they are reporting. Then the doctors would be, number one, they would be curious, And number two, if there was an educational webinar even that could get them informed no matter whether they're rural or city physicians, and get to the most physicians possible, then I think that would help.
I think the critical point is trying to educate the medical community to know what they are dealing with and when to refer to a true NET expert so that the patient receives correct and adequate care.
We encourage patients, caregivers, healthcare providers, and supporters to continue these conversations in public forums and give feedback on our website at thehealingnet.org as we shape programs to optimize neuroendocrine NET cancer care.